Well, hello everyone. It's Clates here again. This is video 2 of the treatment towards getting posts in my mouth. What I said yesterday was I said that today would be the day that I go through the removed teeth, etc., which I have done. As you can see by the fact that my top lip isn't moving or working, it's because it's still numb, although it is starting to wear off. It gave me kind of a false teeth to use for the time being. It makes me sound a little bit strange or talk a bit strangely as well. Here's what it looks like. It's not bad actually, it looks quite good, doesn't it? Now I would take it out to show you what the actual gums look like, but I think I'm not allowed to. They really want me to keep that in at the minute, so I better do what they said. The other thing was they have a policy which means you're not allowed to video in the surgery. So as a result I couldn't video the treatment. So let me tell you a little bit about the treatment, how the treatment went. It was very, very good. First of all, my dentist, his name's Dom, he's actually the guy who's responsible for correcting everything, making everything look nice. And I want to just say he is absolutely amazing. He's the nicest guy I know, and I just love him to it. He's really very helpful and very insightful too in what he talks about. I did say in my first one, I said about, the way he talks doesn't inspire confidence, but really he's trying to emphasize the fact that post should be the end, the last choice rather than the first choice, which just makes sense. I mean, I'd like posts, and that's what I'm hoping I'm going to get, but will I get posts? I have no idea. I mean, the way they've done these false teeth, they work fine. I may well just stay without getting posts. But I mean, that's my main goal. That's what I'm looking at this point in time. So that's Dom, really nice guy, Birmingham Dental Hospital. However, the guy who actually took the teeth out for me, his name is Mohammed. And what a nice guy. Oh man, I tell you, so sympathetic, empathetic, very patient, and very every step of the way he's telling me what he's going to do, how he's going to do it, where he's going to do it. I mean, if you ever have to have treatment at Birmingham Dental Hospital, I can only tell you it is the best place ever, and I'm glad I've been able to get treatment there, that's for sure. Anyway, now going back to what I was saying earlier. So as far as the actual treatment went, now obviously I couldn't video it, so I don't actually know how it looked, but from what I understand, they had to cut the gums, they had to remove broken teeth. They then, Mo, he got some kind of scraper, which he scraped the actual jawbone, top jawbone, to make it nice and smooth, and then it ended up with stitches. Now I don't know how many stitches, I think it's about six or seven stitches in my top mouth. As regards pain, it wasn't really painful, to be honest with you. The worst pain was obviously the injections, when they gave me injections, especially in the top part of my mouth, because these ones here he put numbing gel on, so actually I didn't really feel those, but he had to put injections, that part of the mouth, and that was pretty sharp, but it was only for a few seconds and it's gone like that. So pain wise, that's all of it, all the pain I had. It's now been a couple of hours since the treatment, because I had to get back home, and to be honest with you, it's not all that sore. It might get worse later in the day. I've got painkillers if I need to have it, but it doesn't seem to be that sore at the minute. Although it is only a few hours, so who knows what the result will be for that. Okay, so that's how it's been so far. As you can see, it looks pretty good actually, even though it's just false teeth. So, you know, nothing to complain about, to be honest with you. So the first part of the treatment, I would like to say the worst part of the treatment, but not necessarily the worst part, because if I do end up with posts, they're going to have to cut my gums again, and then I don't split the bone bit or something like that to actually put the posts in. So that part might be the worst part. But at this stage, this has been the worst part so far. From now onwards, it's just going to be adjusting the false teeth, and then letting it settle. I think it's 3 months or something like that. I'm not 100% sure, but that's the idea. So obviously I sound a bit strange. As you can see, my top lip's not working, and that's because it's still numb, or it's only just starting to get back to life. So you won't hear from me now until next week, probably on Friday, because next week Friday, which doesn't mean much to you, because if you watch this 3 weeks from now, you're going to say, Friday? Which Friday is he talking about? Anyway, it's a Friday appointment, and from today, the day that I'm in, also Friday, it'll be 7 days. So 7 days treatment, 7 days to settle everything, and then I go back and then see how it's settled and how, if any adjustments need to be made, etc., etc. But so far it seems to be okay, and it's only a couple hours, so who knows how it's going to go. Anyway, so there you go. So if you're ever thinking of going down the road of getting posts in your mouth, for whatever reason, as I said in my first video to this one now, this is the process you'll probably have to go through. Now maybe yours will be less severe, or hopefully not worse, but I mean mine was pretty bad. You did say that I had quite a lot of treatment done here on top of my mouth, so you know, I don't think it can be much worse. So that's the good news. That's over and done with. Everything looks okay. The pain isn't too severe, and if you happen to have it done at Birmingham Dental Hospital, they're brilliant people. They're really, really nice. So Dom and Mo, they're the two people who worked on my teeth. So, well, until Friday next, or 7 days from now, which is probably better to say that 7 days from now, isn't it? From 7 days from now, you'll hear from me again, and I'll tell you what adjustments had to be made. Was there any more severe pain during the time? Did it settle, not settle, whatever the case may be? But you'll have to wait 7 days, I guess. So thank you very much for listening, and I'll speak to you later. Bye.